Louise, more than 2 million people suffered from an illness they put down to their work last year. Is working really that bad for you?
No, it's not, but I'd like to clarify that it's good work that's good for you, and certainly that can give a lot of positive impacts on the worker, feelings of involvement, job satisfaction, autonomy, and a general feel-good factor, and obviously social inclusion as well. And it's unemployment that can have detrimental effects in terms of physical health and mental health. So if we are able to offer people good work, we're able to reverse the adverse impacts of unemployment.
Why should occupational safety and health professionals be getting involved in workplace health issues in the first place?
Well, they already have had, as part of their training and education, some training in occupational health issues. They also have a lot of transferable skills. For example, they can assess risks. They have also softer skills as well, which makes it very helpful for dealing with people-related health issues. And the other thing to point out is that often many absence issues are not of a clinical nature. They're down to organisational or managerial issues. And practitioners are ideal to get involved in sorting these problems out because they have an excellent knowledge of workplaces and organisational issues. Whereas also, when you look at the numbers involved, IOSH has around 35,000 members, and if we look at the number of trained occupational health specialists, there's probably around 8 to 10,000 of these. So clearly there's many more of us in numbers, and we can help our OH colleagues by working in interdisciplinary teams with them.
So what's IOSH actually doing to help practitioners get involved?
We've got a specific project at the moment which focuses on taking the skills and knowledge that chartered practitioners already have in this area and upskilling them by providing a short training programme in rehabilitation and return to work. The whole initiative is a partnership between the Department of Work and Pensions and IOSH, and at the end of the training, practitioners go back into the workplace and use their new knowledge and skills to implement various occupational health interventions. We'll be monitoring them over a 12-month period on a quarterly basis and gathering data to see how the intervention has gone and in particular the difference it's made.
So after the evaluation's taken place, what's next for the scheme?
Well, at the end of the scheme, we hope that we will have produced enough examples and evidence from the interventions that have been carried out to show that this really can make a difference. And then we would like the government to support a rollout of the programme to around 10,000 health and safety practitioners.
So what about the practitioners who aren't involved in the scheme? What help is there out there for them to get involved in workplace health issues?
Well, a great starting point for them is to go to the IOSH website, where they'll find 2 free resources. The first is an occupational health toolkit, which is a web-based resource. There's 4 health issues covered there: stress, musculoskeletal disorders, skin problems and inhalation disorders. And if they look there, they'll find a whole host of information ranging from very basic information defining the problem through to identifying problems, ideas for preventative action, and ideas also around rehabilitation and return to work. So that's one resource they can look at. There's also a good practice guide on rehabilitation at work called A Healthy Return, which is also available from the IOSH website, and that would be of use to practitioners but also other professionals in organisations.
So what's next for IOSH in terms of the workplace health agenda?
Well, we have an ongoing campaign called Back to Health, Back to Work, and some of the initiatives I've just spoken about are part of that campaign, as well as getting people back into work who've been off through sickness. We also believe in preventing people going off work in the first place. So that's all part of that campaign. Specifically, coming up in the very near future, we have an event we're holding at Westminster with Dame Carol Black, who's the National Director for Work and Health, together with a selection of cross-party MPs and peers, to really discuss the whole occupational health and work agenda, and really how we take forward ideas and support the much needed drive to get a healthier UK PLC, and really to get people to be at work, healthy at work and happy at work.
Thanks for your time, Louise.
Thank you.